Planning a baby? 6 fertility myths you should stop believing. Common infertility myths to watch out for. Fertility myths you should stop believing. When you decide to go the family way, there's considerable amount of advice you get from your family and friends. Of course, all the advice you get may also be riddled with old wives' tales and not all scientific in basis. Truth be told, there are so many tips and myths people believe about conception, it can be hard to determine which works and which doesn't. It can also be uncomfortable for couples to receive advice, especially when they have been trying to have a baby for a while. We bust 6 such myths for you. Fertility is only a woman's responsibility. It takes 2 people to make a baby, not just one. For a couple who's finding it difficult to conceive, the first fingers are always pointed towards a woman. In fact, it's nothing but a tall myth that it's always the women who are infertile. Nearly 30 to 40% of cases account for male infertility. Only proper medical tests and diagnosis can tell what the root cause of infertility is, and the next steps you might need to take. Conceiving after age is impossible. Late pregnancy might be difficult, but definitely not impossible. A lot of couples plan late pregnancies and go on to have healthy babies. Even though the chances of conception and fertility lower down after age, it is not naturally impossible for women to conceive. There are also medical procedures, such as IVF, which can help boost your odds of getting pregnant. As long as a woman ovulates, and has no existing conditions which deter fertility, having a baby is absolutely possible. You are not doing it right. Sex makes a baby, correct? But some people claim to know the best sexual position to fertilize the egg or the best way to conceive a girl. There are also some who say that having sex at a certain time of the day, or after a certain activity, boosts the chance of conception. All this should never be blindly believed. Yes, they may work for some, but it's not a universal rule. The only thing that can really boost your fertility is the frequency of sexual intercourse. The couple needs to relax. For couples who struggle to conceive, stress is always blamed as a factor. It is seldom recommended that couples head for a vacation to relax themselves. While stress is often a trigger that can impact hormonal functioning, sleep, or relationship for that matter, it doesn't actually impact sex. As we mentioned, only the frequency of sexual intercourse and the understanding between you and your partner can strengthen the chances of conception. People who have been pregnant before won't face fertility issues. Fertility issues don't just impact first-timers. Even those who have had a baby before, without any hiccups, can face issues the second or the third time around. This type of fertility is what experts refer to as secondary infertility and does affect a lot of people. Therefore, it is always recommended that people who plan a baby in 30s consult specialists if they face trouble conceiving naturally in the initial months. A woman needs to ovulate to conceive. An embryo develops when the sperm and the egg fuse together. The time when a woman ovulates is considered to be the best time to get pregnant. However, couples should know that sperms can live for up to 72 hours, and hence, conception is possible even outside the ovulation window. When should you consult a doctor? The more often you try, the better are your odds of conception. Having sex at a fertile time of the month can help. However, infertility can also be commonly experienced. According to specialists, a couple should consider getting help if natural conception doesn't happen 6 months after trying for a baby.